Hi everyone, I'm Donna Hamilton. Say Baltimore and what springs to mind? Crab cakes, Cal Ripken, Fort McHenry, but don't forget Mercy Medical Center. Mercy anchors Baltimore's downtown business district and is known for delivering academic hospital caliber care in a community setting. Investing in a Gallup study and dispatching a team to visit women's centers all across the country, Mercy has become one of the first hospitals in the United States to focus its mission on the care of women. In medicine, terms like cutting edge and state-of-the-art are tossed around quite a bit, but sometimes they truly apply. Consider the work of Mercy plastic surgeon Dr. Bernie Chang. Recognized as one of the finest breast reconstructive surgeons in the nation, Dr. Chang offers his patients an option that few can: reconstruction using the patient's own tissue. Working in tandem with Mercy's top breast cancer surgeons, Dr. Chang is always on the cutting edge of his craft.
When I first met with the people at Mercy, they said, you know what, we have big plans for Mercy and for the Women's Center, and you know, that was actually a pretty big impetus for me to decide to come here. And also Dr. Friedman and Dr. Rosenshine and everyone else before. I started out with just a nurse, front desk person, me and a PA.
A small team.
Yeah, it was a small team, and over the years we now have 4 PAs in the operating room, wow. 2 PAs in the office, you know, 3 plastic surgeons now, and you know, the program's really expanded.
What are you most proud of being able to accomplish here for women?
We've improved techniques so much now that there's way less side effects on patients, and quicker and easier recovery. Even the length of the surgery is like shortened by over 50% just because of efficiencies and also just developing all these different techniques.
Right. Yeah, and I know that you specialize in breast reconstruction. That's really your special area.
As a microsurgeon, we're now freed up to be able to transfer parts from one part to another without having to leave things attached. So you know, it's basically, well, we call it a free flap procedure, but it really frees up on all the different donor sites that you can use for reconstruction. We now can take it from the same place, but without having to remove any muscle. It's really very similar to a true tummy tuck. You can take it from the buttock area, which we've developed even here at Mercy as part of a newer innovative technique. You can take it from the inner thighs, posterior thigh area. So you're free to kind of take it from a lot of different areas. I remember, I think it was probably like 1994. I was a junior, just attending, just starting out, and I remember going to one of our big national meetings, and I was speaking to Dr. Hartramp, who developed the tram flap procedure. And I remember him telling me at that meeting, even though it was a great way to do reconstruction, he said, there's got to be a better way. Things have really changed a lot since the 90s.
Sounds like. And that's now considered really the gold standard for women in reconstruction surgery.
Absolutely, yeah. I mean, to me, it really is the state-of-the-art finesse way to do reconstruction.
I'm sure you've seen some patients come in, just from what I hear you say, that have failed other reconstruction, and they must come in and they must be so sad, and they don't feel good, and they're desperate for something.
People don't feel whole, if they've had a mastectomy, and
when something won't get well, and it's
and
just
a lot of them are told, well, that's all we can do, and we have nothing else to offer. So, but it's not really true. I mean, there are so many patients you can still help using these techniques.
Right. That's when it gets back to, I think, being your own advocate and not just accepting what someone tells you, and keeping up the search.
If you're a patient and you live in Richmond or wherever, I mean, you should have that as an option. You shouldn't have to, travel 4 hours to go somewhere to have something like that done. So I think just getting more people aware of that, and also having more surgeons trained in doing these kind of things.
You do a lot of training, right?
Yeah, we have a fellowship program. when I came to Mercy, that was the first thing that I wanted them to commit to me to, only because, you know, I mean, being at Hopkins for 10 years, I really feel like, you know, we need to pass on some of our knowledge to future generations.
Right.
So, you know, we're not going to be here forever, and, you know, I get asked that all the time lately, are you going to retire soon? And it's like, no, I'm not going to retire.
I'll let you know.
I'm going to die in the operating room, so I'm just telling you that right now. Plus, all the fellows that have been here over the years, you know, I get to spend a whole year with them. They come from programs all over the country, Boston, you know, St. Louis, Texas, all from really, you know, good programs. And I really, you know, feel like I form a bond with them.
I'm sure you do.
So to be able to go to meetings and discuss things and meet, you know, previous fellows or colleagues, I think is really awesome.
I talked to someone, this was years ago, and a dermatologist, and she said, well, if you ever want to consider a neck lift, go to Bernie Chang, because he does the best neck lifts in town. They're talking about you.
Well, you know,
in a good way.
That's okay by me.
Few in medicine today would argue the importance of women's health care, but that was not always the case. Mercy Medical Center was one of the first hospitals in the nation to recognize the need for a program dedicated to women's health. Armed with a vision, Mercy doctors and administrators joined with the Sisters of Mercy to create a center specifically designed for the diagnosis and treatment of women's disease, from breast and ovarian cancer to all manner of GYN conditions. Today, the Weinberg Center for Women's Health and Medicine at Mercy is recognized as among the best, providing quality care in a compassionate setting. I hope you've enjoyed this opportunity to become better acquainted with Mercy and its mission of caring, as seen in the physicians who have made this mission their own.